Greetings, I'm Dr. William Lanier of Mayo Clinic Proceedings, and I welcome you to the multimedia summary of the journal's February 2017 issue. There are 4 articles that have been designated Editor's Choice or Highlight selections in this month's issue of the journal. Our Editor's Choice is an original article by Dr. Alana Chamberlain and colleagues affiliated with the Department of Health Sciences Research and the Division of Cardiovascular Diseases at Mayo Clinic in Rochester, Minnesota, and the Department of Epidemiology and Preventive Medicine, Tel Aviv University, Israel. The authors reviewed all causes of hospitalizations for patients after a diagnosis of heart failure. All patients were residents of Olmsted County, Minnesota, and were initially diagnosed with heart failure between 2000 and 2011. There was a 2-year follow-up period after the diagnosis. The authors concluded that patients with heart failure experienced high rates of hospitalizations, particularly within the first 30 days after diagnosis. Hospitalizations were most commonly for non-cardiovascular causes, and they were most common in patients who had a previous diagnosis of myocardial infarction, chronic obstructive pulmonary disease, cancer, or dementia. This article is introduced by an editorial written by Dr. Hector Ventura from the John Ochsner Heart and Vascular Institute, New Orleans, Louisiana, and Dr. Mark Silver from Advocate Christ Medical Center and the University of Illinois at Chicago. They concluded that when attempting to reduce the risk of hospitalizations in patients who carry a diagnosis of heart failure, there is utility in directing long-term patient care towards managing comorbidities, not just towards managing heart failure per se. Our first highlights article in the February 2017 issue of the Proceedings focuses on the management of adult onset seizures, and this article is the first installment within the journal's new symposium on neurosciences. The highlighted seizure article is authored by Drs. Amy Crapo and Joseph Servin from Mayo Clinic in Phoenix, Arizona. The article discusses treatment options available for adults with epilepsy, including medical, surgical, dietary, and device therapies. The article also addresses ideal treatment options for special populations such as pregnant women and the elderly, and discusses the possible uses of neuromodulation therapy, vagus nerve stimulation, trigeminal nerve stimulation, deep brain stimulation, and other surgical options. The authors note that the goal for all patients is to achieve freedom from seizure activity, and when this is not possible, to reduce the number of seizures. The article is accompanied by an editorial that introduces the entire Symposium on Neurosciences collection. The editorial is authored by Drs. Michelle Maurerman, James Meskia, and Joseph Servin, editors for the Neurosciences Symposium series. They are respectively from Mayo Clinic in Rochester, Minnesota, Jacksonville, Florida, and Phoenix, Arizona. The second highlights article in this month's issue is a review article on childhood obesity by Dr. Seema Kumar from Mayo Clinic in Rochester, Minnesota, and Dr. Aaron Kelly from the University of Minnesota in Minneapolis. They discuss the epidemiology and risk for multiple comorbidities previously considered to be adult diseases, such as type 2 diabetes mellitus, hypertension, dyslipidemia, obstructive sleep apnea, non-alcoholic fatty liver disease, and others. They recommend a staged approach to treatment with a focus on healthy eating habits and an active lifestyle. The third highlights article in this month's issue is a concise review on palliative care and hospice by Dr. Mary Buss and colleagues from Beth Israel Deaconess Medical Center in Boston, Massachusetts. In this review, the authors define palliative care, describe how it differs from hospice care, debunk some common myths associated with both hospice and palliative care, and offer suggestions for how primary care providers can integrate palliative care into their practices. The authors conclude that use of this knowledge will greatly improve symptoms management and quality of life for patients throughout the course of life-threatening illness, not just at the end of life. As always, you can access these fine highlights and Editor's Choice articles free of charge during the entire month of February. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org and review some of the other free content there. You can access the social media buttons near the top of our homepage to follow us on Facebook, Twitter, and YouTube, where you can remain current on online first publications that are introduced on our website between the monthly issue updates. Our website also lists many news stories that are based on articles published in Mayo Clinic Proceedings. On YouTube, you can find video content such as full author interviews or our 60-second video article summaries. Also, please take notice of our new feature that we're calling Mayo Clinic Proceedings Fireside Chats. This started in January 2017. These chats consist of audio-only podcasts of monthly issue summaries as well as author insights, all collated in a single recording. This feature is ideal for review during your travels or during relaxation time in your off hours. It is available through iTunes in addition to access from our website. As always, thank you for your interest in and support of Mayo Clinic Proceedings. We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.